Hello everyone, I'm going to show you guys one-handed tie today. First I'm going to explain benefit of one-handed tie. It's faster than instrument tie, and you can use whenever you don't have any instrument, and you can feel the tension directly, and you can access to deep tissues using hand ties, and it reduces the tissue trauma. First I'm going to show you guys how right hand surgeon need to do one-handed tie. So one-handed tie, you have two movements. First movement, I'm going to use my pointer. Second movement, I'm going to use my middle finger. First I'll keep it horizontal, later you can do vertical. And this is my forehand. I'm going to do forehand, and either you can just hold it. This is your needle side, and you need to make sure right hand surgeons keep their needle in right hand side like this. So you can either just hold it, or you can guard the needle from the needle driver like this, then you can hold it. Okay, so now in your left hand, make sure you hold it ring finger and thumb. So I'm going to do my first movement. So to do the first movement, I'm just go over these two fingers, pointer and middle, in your left hand. So whenever you do that one, make sure you have a nice circle. See here, I have a nice circle. If you come this way, you don't have a circle, right? See, make sure you have a nice circle. Then I'm going to use my pointer finger. So watch careful here. You bend, go under and over, squeeze. Squeeze using your middle finger and pointer. Now you can release your thumb and ring finger. So then I have to go through the loop, and you have to push this one. Make sure again you have a nice circle. See here, I have a nice circle. If you twist it, it's not going to make it, and you're not getting a square knot. So push it down. So this is your first movement. So do the second movement. I have to use the pointer finger. To do that, I have to release this one. I hold it, thumb and pointer. I'm going to use my middle finger for the second movement. See here, then your three fingers are fixed, go over, then you can bring your middle side again, this side, like that. So you have a nice circle. If you bring it here, no circle. Make sure always you have a nice circle. That way you're not going to mess this. So then I'm going to use my middle finger for the second movement. See here, I bend it over, under, squeeze, ring finger and middle finger through. Then I can release my pointer and thumb. Then you have to go through the loop. This is going to be your second movement. Then you have a complete square knot. So I'm keep doing this one, 1 2 1 2. To do the first motion again, see, it's a small transition here. You need to do this one palm down. Since you need to see through camera, that's why I just do this one palm up, but best way is doing palm down like this. You hold it, your pointer, your thumb and middle finger, then transition to ring finger and thumb. Why? Because we need to get to this position for our first movement. That's why we stay for our first movement. All right, again, so hold it ring finger and thumb, then you go over, make sure you have a nice circle, then you use pointer finger, under, over, squeeze, pointer and middle finger, then through the loop you can release, then ring finger and thumb directions. Again you hold it pointer and thumb, release these fingers, palm up, go come over this side, use your middle finger, second movement, squeeze, ring finger and middle finger, release pointer and thumb through the loop like that. Then transition, middle finger and thumb, then transition to ring finger and thumb, then come back again, then go over, then use your pointer finger first motion like that. You keep doing this one. So just comment me if you have any questions. Thank you.